Please subscribe my channel and press the bell icon. Today our topic is skin diseases. First of all, we have acne. It is most common skin problem. Block skin follicle with bacteria, dead cell and oil. Symptoms. First, pimple, redness and tenderness, whitehead, blackhead, pustules, nodules, pus fills, papules, small painful lump. Eczema, atopic dermatitis, causes, allergy and types. First, hypersensitivity reaction. Symptoms: dry crack pain, aching, rash on swallow skin, oozing and crusting. Contrast dermatitis. Types of skin inflammation, causes, contact with allergen. Symptoms: achy, rash, dry crack, scaly skin, blister, swelling, burning, tenderness, oozing, crusting. Psoriasis, causes, autoimmune disease. Symptoms: white silver color, patches, dry crack bleed, itching, burning, joint pain and stiffness, thick yellow cracked nail. Urticaria, hives. Causes: allergy. Symptoms: raised wheals of various size, red or skin color, itching, swelling around wheals, painful. Vitiligo, leukoderma, causes, extra cause, unknown, autoimmune disease. Symptoms: white patches, hair turning gray and white. Pemphigus, causes, autoimmune disease. Symptoms: blister on skin and mucous membrane, painful but not itching. Scabies, causes, sarcoptes, scabby, itch mite. Symptoms: itching in night, bump and redness, rash. Ringworm, causes, fungal infections, dermatophyte. Symptom: raise, scaly patches, plugs. Plugs are ring-like with deeper outline, blister and pustules, hair loss. Rosacea, cause, unknown, autoimmune disease. Symptoms: dry skin, rash like acne, swollen blood vessels in skin, itching, butterfly-like red rash on face, burning sensation, dry, swollen eyes. What? Cause infection of human papillomavirus. Symptoms: small growth on skin, itching, rough on touch. Shingles. Causes: viral infection by herpes zoster. Symptoms: pain, burning, tingling, red rash, flood filled, blister, itching, fever, headache, fatigue. Folliculitis. Causes: infection of Staphylococcus aureus. Symptoms: blister, rashes, pimples or redness, swelling and itching, pus. Common treatment of skin disease. Its are antihistamine, antibiotic therapy, corticosteroid therapy, vitamin injection, laser therapy, light therapy. Common nursing care for skin disease. That are good person hygiene, skin care, dietary change, balanced diet, avoid sharing of utensil, drink plenty of water, avoid stress, use moisturize, avoid contact with allergen, sleep at least 7 hours, protect skin from extreme heat, cool, wear loose cotton clothes, avoid sun exposure. Thank you for watching my video.